My name is Daxa. I'm a staff nurse at the Willows on Acacia Ward. As a mental health nurse, I would say it is the best thing that I have ever done, and I think working as a support worker and then going to do my training was the key thing, and it just opened my eyes to see how best I can help these patients. The career path that led me to my job as a staff nurse was basically I used to work on the bank as a support worker for many years over at the Towers Hospital, over at the Brandon unit, and I really enjoyed my time with the patients. It was that really made me feel that this is the kind of job that I want to do for the future. The patients that I was with, they were absolutely fantastic, and it made it all worthwhile. My typical work days is coming into work, having handover from the morning staff or the night staff, organising all the staff on the ward, so I have to delegate duties of who's doing what duties throughout the day, so everybody is aware of their roles throughout that morning shift or afternoon shift. Once that is done, we'll make sure that all the patients have got their food, breakfast and that, all their observations is done, and medication has been done as well. Once the medication and everything is done, we do spend time with the patients, have quite a lot of regular one-to-ones with the patients. There's quite a lot of therapeutic activities that happens on the unit and also on the ward, so we've got to ensure that the patients are up for doing those kind of things. We also try and get the patients to daily activities, and it's really difficult sometimes when they're not feeling too brilliant. So it's all about trying to motivate those patients to be up and about. We used to do shift work, so it used to be like earlies, lates and nights. Now we are doing actually long days. So people start from 7 till 7:30 in the evenings, and then the night staff will start from 7 in the evening until 7:30 in the morning. This gives people a lot of time off as well on the days off, and I think that has really worked with people, but also the continuing of care for patients, and I think the patients actually appreciates that as well. As a Band 5, we have quite a lot of opportunities to do quite a lot of training, so there is quite a lot of training available, which I have done, but also for the fact that I can go further, and if I wanted to become a Band 6 or a Band 7, there are opportunities for me to do that, so there is lots of opportunities. I'm a lead for the dual diagnosis, I'm a lead for moving and handling, I'm a lead for the students here at the Willows. And I'm also involved in quite a lot of physical things here as well. So I do bloods, I do take bloods, I do ECGs. So there is so much in this area that I have done, and I can continue to progress if I needed to as well. Communication skills, that is really important. Listening is the most important things. Because obviously with patients who are quite unwell, sometimes they feel as though that they've not been heard, so I do believe the listening skills is really important. Being with the patients, I think that's the most enjoyable. The staff makes it as well. That really does the whole thing about my job that I really enjoy.